Ryan of Wisconsin joins us right now from Washington. I wonder, Congressman, how you feel about sort of being, in essence, a political hot potato by walking into the middle of the room and saying, look at that giant stack of paper on Dylan Ratigan's show, although I'm sure that's not what you're saying. If we don't deal with that stack of paper, the little, whether it's a Republican plan or a Democrat's plan, Obama, to tear up a page or a page and a half of paper out of a stack that big, may be good politics, and $2 billion sounds like a lot of money, but it's a comically small number proportionally.
That's exactly my point. Look, if fixing these problems was politically easy, we would have done it already by now. But you just can't disguise these numbers. I mean, we have a fiscal problem that is just so monumental, Dylan, that we got to attack this, and the sooner the better. And now look, you don't have to hurt grandma right now. The whole point of my plan is that if you are in or near retirement, over 55 years old, we can guarantee your Social Security and Medicare benefits. But for our generation, those of us under 55 and beyond, look, we're not going to have these programs anywhere. They're going bankrupt. So we've got to reform them to make them sustainable for the future. And the way in which I propose to reform them is to give people the same kinds of choices like I have as a member of Congress and a federal employee when I buy my health care and get my retirement
And listen,
benefit.
you don't have to convince me, as somebody who's been out here since I showed up at MSNBC talking about personal freedom, personal liberation, personal responsibility, so much support obviously for Wyden Bennett and all the rest of it. I get it. But at the same time, I watch the politicians, whether it's the politicians around Ron Wyden or the politicians around you, backpedal when people like you start to talk the way you're talking, because while you may be right, it will cost you your job.
Ron and I have compared notes, and we've had the same experiences. Look, the way I try to tell my colleagues, whether they're Republicans or Democrats, who are just saying, don't touch this, this is too tough politics, I tell them, look, what if your member of Congress saw the last financial crisis coming, knew about it, knew the timing, nature, and scope of it ahead of time, and knew how to prevent it, but chose not to do so because it was just not good politics? What would you think of that guy? You'd want to fire him. Well, this is the most predictable economic crisis we've ever had in the history of this country. We know its timing, we know its nature, and we know what we need to do to prevent it. We will have a debt crisis in this country that will come to us pretty quickly if we don't do anything. Look, the General Accountability Office last year told us for Medicare, Medicaid, and Social Security, we're $62 trillion in the hole. You know what they're telling us this year? That number is now $76 trillion, just from last year to this year. So we are courting a huge debt crisis, which means lower standards of living for future generations, which means massive debt and massive debt crises like what you see in Greece if we don't head this off in the past. And that's why I'm simply saying, do it now. It's far less painful if you do it now.
A couple of things. And I agree with everything you just said, and we can get into debate, and I'm sure we will, about how and when and where this gets done. But obviously that is the problem. What really strikes me, again, 9 months into my political commentary career here at MSNBC after 15 years at CNBC, is how unwilling politicians seem to be to actually deal in reality. What, if anything, will make them fearful enough for their jobs that they actually do their jobs, as opposed to trying to protect their jobs by lying to Americans and taking money from special interests, which is what at least they are perceived to do for a living.
Right. That's what I'm trying to figure out, Dylan, to be honest with you. I mean, I put this plan out 2 years ago, put a new version of it out with fresh numbers from CBO saying it does what I say it does. And what I'm trying to do is say, look, I don't have all the ideas. I'm not saying I have it all figured out. I'm saying, here's my idea on how to prevent this fiscal crisis. Please, other Republicans, other Democrats, come up with your ideas so we can get down to the business of talking about how to fix these problems. My hope and goal in this, Dylan, is to change the politics of it so that the third rail is no longer touching these programs, but the third rail is ignoring these problems.
Yeah. All right, real quick, let's talk about the current piece of health care legislation. I had the privilege of talking to the majority leader yesterday, Steny Hoyer. I'd like to play a sampling of what he said about how he views this piece of legislation. We were talking specifically about the fact that there aren't a lot of people that are allowed to participate in the exchanges, and I asked him why that was and how he looked at it. Take a listen.
For heaven's sake, do the right thing. Don't cut Medicare. Don't do an unfunded mandate to the states.
That was obviously not Steny Hoyer.
That wasn't Steny Hoyer.
That's the pleasure of pretending to be very confident as a television host, Congressman Ryan, and yet having no control whatsoever because the buttons are pushed on a different floor of the building altogether. But I'll read it to you. Basically said only 1 million Americans. We're talking about the exchanges. Now, there's a correction there. It's 1 million Americans in the Senate bill, and then some of the uninsured, 26 million would actually be able to. So you get 27 million total at the exchanges. But his ultimate point was that this is, again, a phase-in. As you know, he says, yes. And as you know, under the bill, we are authorized to expand as we go along. So if you look at for instance, redirecting the tax credits to people and away from corporations and expanding the accessibility of those exchanges, right, which you and I both know will bring prices down, or at least give us a fair price as opposed to a rigged price, and we can take it from there. Do you view this bill? Can you see this bill incrementally?
No. So this bill is designed to incrementally bring in these reforms, and the exchanges and the subsidies don't kick in until 2014. So if you're talking about the Senate bill that they're trying to pass here, that is an incremental thing. I don't think the projections on how many people will ultimately be in the exchange are accurate. I personally think it will be much higher, because I think people are going to get dumped off of their health insurance plan that they have with their job. And I think a lot of people in the individual market who buy their own health insurance are going to lose it in the next 1 or 2 years. So I think more people will be forced in these exchanges, which don't actually set up for a few years. So if you do what I'm proposing, or what Ron Wyden's proposing, start these state-based exchanges now, delink the tax credit from the job and attach it to the employee, to the worker, right, so you have it no matter what you do. If you lose your job, if you go work for yourself, you get the same tax benefit, and then you use it to shop through these exchanges to get good deals and to have competition among insurers. What we're trying to do in our bill is change the whole emphasis. Instead of having the government as the nucleus of the healthcare system, we want it to be the patient and the doctor. And we want the competition to be not us begging for mercy from bureaucrats. We want the competition to be have doctors, insurance companies, and hospitals compete against each other for our business as patients. That competitive dynamic, which is basically a market-based system, wherever applied elsewhere in America, works to bring up quality, lower costs. I got LASIK 10 years ago. It cost me $4 grand. Costs $1,600 at the same place now, and it's a better surgery. So it's not as if healthcare is immune from these market principles being applied. We just haven't applied them.
Yeah. Again, my last question, whether it's you or Ron Wyden, why do you think plans like that have basically been pushed into the ditch?
Because I think this is less about healthcare policy and more about ideology. I really believe this, and it's just the conclusion that I have reluctantly come to, which is they could have had good bipartisan deals with many of us to address cost and quality and health insurance for the uninsured and those with pre-existing conditions. We could have done that before August. I believe this is really more about political philosophy and agenda, which is an ideological idea to have the government take this whole system over. And that, to me, is something that is basically having the American idea of promoting equal opportunity being replaced with more of a Western European cradle-to-grave social democracy welfare state, where the goal of government isn't promote equal opportunity, but to equalize the results of our lives. And I just think that's the ideology that dominates the White House and the people running Congress right now.
Right, listen, now, Congressman, I know we're out of time. I'd love to talk banks and taxes with you another time, but not right now. A pleasure to have the time with you today. All right, talk to you soon.
Thanks, Dylan.
Still ahead.